Okay, Mr. Chairman, I think we're ready to start.
All right, thank you. So I'll call to order this Thursday, October 1st meeting of the Eastern Idaho Board of Health. Appreciate each one of you being with us, taking time out of your day this morning. We particularly appreciate Director Rakow, Mr. Corbett, and all the staff that are also in the meeting with us today. This meeting is being streamed on YouTube where the public can see it live. There's also a room set up at the Eastern Idaho Public Health Building where public can come to view the meeting. We are using Zoom webinar for our board members, and again, appreciate all your time. I first want to acknowledge the exceptional job by Director Rakow, Mr. Corbett at School District 91 board meeting last night. I know they took considerable time out of an invitation from the school board to attend their meeting and provide information to them. The time that has been provided by our director and our epidemiologists has really been unprecedented. They have been responsive in every situation, and I know I can speak for the board when I say give our appreciation for everything that you are doing. It has really been exceptional. So just thank you. I need to begin with a roll call of our board members. So we'll start with Teton County.
Bill Lake here.
And Jefferson County.
Shane Young here.
Madison County.
Brent Mendenhall here.
Thank you. Jefferson County.
You did me, Shane Young present.
I'm sorry.
So, all right, it's early.
Thank you, Commissioner Young. Let's see, Clark County.
Commissioner Shenton here.
And we have Lemhi County.
Ken Miner, present.
Custer County. Commissioner Butts, I believe, will not be able to attend today and has given his proxy to Commissioner Shenton from Clark County. Our physician.
Barbara Nelson, present.
Thank you, Dr. Nelson. And of course, I'm Brian Reed from Bonneville County. So we have 7 of the counties represented.
Lee Miller.
I'm sorry, Commissioner Miller. That's the one that I doubled up on when I counted my 8.
Oh, you're fine. Lee Miller, present.
Thank you, Commissioner. So thank you again for all of you being present. We'll begin with a approval of our September 24th minutes. They're on the screen now. I know you've all received them. Could I get a motion to approve or recommendations for any changes needed?
I move to accept the minutes from September 24th.
Thank
Commissioner
you.
Commissioner Mendenhall, second.
Thank you. We have a motion and a second. All in favor, say aye.
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 Is there anyone opposed? All right, thank you. We'll move into our review of public comment. I'll just briefly recap them as I typically do. I know we received a couple of emails who were from individuals who were strongly opposed to our plan and the actions that we've taken. They would like to see all restrictions lifted. I'm sure that you've all read those. They were very well worded and informational emails. We appreciate them, and as always, we need to consider all comments that we receive. We also received emails from individuals in Madison and Jefferson counties regarding their high numbers, particularly Madison County, and asking what further actions that we will take to do more in those areas. I think that along with that, we received an email from Madison County pointing out that although their case numbers are very high, hospitalizations have not changed, and asking that we do not take further actions. We received one really detailed analysis of COVID infections, along with predictions from an individual who has put a considerable amount of work into it. I know Director Rakow, Mr. Corbett, and Dr. Nelson all met with Mr. Duffy and are continuing to review all the information. I would encourage all board members to continue reviewing that as well, because we will need to take a closer look at that. We appreciate the information that we've received. Are there other comments from board members concerning any comments you've received this week or that we've all received and you'd like to point out?
This is Commissioner Young. I was just wondering, yeah, one of the emails did point out, I think it's probably the one you're referring to, in that talked about rapid testing. And although that may be a wonderful tool to use, do we really have that kind of capabilities here in our health district to do something like that? Can somebody address that?
Director Echo.
Commissioner Ryan, thank you for the question. And it's something that we've been talking about from day one, that testing certainly has been a challenge within our health district. As I report, frequently, that capacity is improving. Rapid test capacity is improving as more and more healthcare providers are able to get those testing machines or those test kits to be able to do those within their offices. And I shared before that we are continuing to work with Express Lab here in Idaho Falls, that we'll be able to do high throughput testing with hopefully a 24-hour turnaround time. We're anticipating that to be up and running very, very soon. But are we at the point that we have rapid testing for every single individual that wants it? The answer is no.
Okay. Thank you.
Appreciate that.
Mr. Chairman, if I might.
Go ahead.
A couple of the emails that did come in, there was a Dr. Keltner and talked about viral load. And I did reach out to Dr. Nelson, our physician on the board, and ask her about viral load. And a lot of it tied into, yes, Madison County, I think last night was 220 cases, surpassed Bonneville County. And yet our hospital is not overrun. And it did cause me to stop and think, and I don't know at what point, but we talk about the changing science that we find with this virus and how different things change that we didn't know 6 months ago. And I'm not sure when we maybe take it some time. I don't know. I know that James and Jerry are all over this every day. But I don't know when we start saying, is it active cases that we should be measuring? When I see us go through the roof and see isolation with BYU Idaho, with school students up in Teton County, they've gone to 37 cases and they've closed down entire classes of schools. I'm not sure. I'm at a loss. I'm not sure that we started out with active cases and that was a great measure. We put metrics. It helped us bring health orders into place. I don't know if there's a time, and I don't know if active cases are still the best measure we have. We've always kept hospitalization in the background, and that was our measure, and that was what we were trying to help avoid, was deeper hospitalization. What I'm getting at and what I am saying is with things that are coming in, and as Dr. Nelson gets more information from the different journals of medicine and that kind of thing, I don't know. I don't know if we're going to continue to increase regardless of whether people are wearing face coverings, how much more education we can do on sanitary measures. I am at a loss. I'm not sure that anymore. I'm hesitant that active cases are the measure for everything that we take action on. I'm not sure. and I don't know, Dr. Nelson, Jerry, I feel like I'm rambling, but it's just starting to become apparent that yes, we have the cases, but the hospitalizations and the extent of illness and the impact that it's having is not as much as perhaps it was 7 months ago before we knew anything about it.
Commissioner Mendenhall,
Yes, please.
hospitalizations are a lagging indicator. They usually increase at least 2 weeks behind some of the rises in cases. And we have heard a lot of issues about masking compliance in your county. So to start backing down on any measures, I think we need to wait, and we need to do all we can to increase compliance.
And I would agree, Dr. Nelson. I'm not questioning that. I'm trying to get the correlation and the connection to increases, the dramatic increases in active cases and the identification of probables and positives compared to the extent of how significant people are ill. I understand the hospitalization and that it could take that length of time, but I just can't help in the back of my non-medical mind saying, if we have 220 cases, why have we not overrun all of the facilities? And even Bonneville County, why have the facilities, they've been at 220, 230 for a month and a half. I'm not saying we back off, not any means whatsoever. We have to continue on in a path. I'm just trying to get a grasp on it.
Well, let me say that we always have tried to tie the hospitalizations to the case count. So, and typically that was about 4%. If we're seeing that number change, then certainly that data needs to be looked at, and that would potentially result in a change in our plan so that we keep that accurate. Is that correct, Director?
Yes. And I don't know if you want to talk about it now or later, but certainly what we are continually doing is evaluating all the components that play into COVID-19, not just the active cases. We're looking at many different measures. And certainly with this increase in Madison County specifically, it is causing James and I to delve into that. We need to have additional in-depth discussions with our hospital partners, and I'm hoping to get that done in the next few days so that by next week's board meeting, we can have a much more in-depth conversation about this very thing.
Thank you.
Thank you. And with that, maybe before we continue the discussion in that way, let's go to our next item on our agenda, which would be a report from our hospitals and see exactly where we're at this time. So it looks like, let's see, if we've got Mr. Jackman on, and they're first on the agenda, the Idaho Falls Community Hospital. Thank you for joining us. Would you help us understand where you're at this week?
Good morning. We have seen a continued uptick in the number of COVID patients that we're seeing and the severity of the COVID patients that we're seeing. Unfortunately, we have had 2 COVID deaths since the last meeting. We're currently sitting at 6 COVID patients in the ICU, 4 of which are on ventilators. And we have 7 COVID patients on our med-surg floor. One of the problems that we're running into is, as a startup hospital, we are not at full staff yet. And so even though building wise, I'm only at 55% of capacity, I have met the capacity for my ICU with other general patients as well. So our ICU as of last night is on divert. Our med-surg floor, we're only able to accept a few more patients before we'll be full. We do have some discharges planned today, so that'll help a little bit. But overall, what we've seen in that algorithm that I've mentioned before is we are currently sitting past the second warning level, which means we're meeting with our physicians on a daily basis and discussing what we can do. But our limitations really are staffing and being able to have enough nurses to take care of the patients. Unfortunately, the COVID patients, as sick as they are, do require a different nurse to patient ratio than general patients. And so that does eat up our resources fairly quickly.
Mr. Jackman, would you help us understand exactly what it means when you say you're on a divert status?
That means I am not able to accept any more intensive care patients.
Okay, and so they would be sent to another hospital.
We would have to transfer them to another hospital. We've received several patients over the past couple of weeks from Pocatello because they were on divert. They had several of their ICU nurses test positive for COVID. And so that decreased their capacity quite a bit. We've received some from Bingham County because they were at capacity. The last patient that I was involved with that we received, I know that Pocatello had also checked with St. Luke's in Twin Falls. They had a few beds available, and McKay-D down in Ogden had a few beds available. But it is on the rise for hospitalizations up and down the I-15 corridor.
Okay, thank you. Any questions from the board for Mr. Jackman? We'll move on then to Eastern Idaho Regional Medical Center. Excuse me, Mr. Hoffenberg, you want to start out?
Sure. Good morning. Can you hear me?
Good morning. Thank you for being here.
Yeah, thank you. So we are at very similar situation. We are obviously we have more patients, but as a percentage of our overall admissions, we're probably very similar to Casey's team. But right now we have 6 patients in our ICU that are COVID positive, and then another right now 10 on our med-surg floor. We did discharge 2 patients yesterday, but we also have had, since the last meeting, multiple COVID deaths, and both were in the ICU setting. And right now, after speaking to Dr. Krell, and I can let Dr. Ballard, who's our chief medical officer, he's also on, what we're seeing is the long stay of these patients to continuing to increase. So, and the likelihood that once they're on ventilators, just the mortality rates seem to rise quite a bit. And so that's been a real indicator for us and something we're watching very closely. Right now, we do have the ability to admit into our ICUs, but just like Casey, staffing has been our biggest challenge right now. It's not physical space, it's more the people able to care for the patients when they're needing to come. Now, we've not reached a divert status, but we are always looking at every admission to make sure that we have the capability and that we're the right place for the patient to receive care based on the level of resources that we have. Because like it's been said, the COVID patients take a number of different resources, especially if the patient is needing proning or some other type of treatment that requires multiple nursing team members. Sometimes those types of patients are just beyond our ability to take. So we do have to really watch every single admission, and that includes non-COVIDs. Right now, it's not truly the COVIDs that are putting us in the situation that we are. We are still full of traumas, strokes, burn patients, cardiac patients. And so our ability as a regional medical center to remain open and have capacity is dependent on our resources. And so we have to be very mindful and always be available for patients needing immediate emergent interventions. And that's how the position we play for the region, serving patients from Salmon, from southwestern Montana, all of western Wyoming, and eastern Idaho. We have to be able to keep our doors open at all times so those patients can receive care at Irmac. So I do understand. I heard the discussion this morning, the questions around our hospitalizations, the measure. Though we are seeing, not a drastic increase in hospitalizations, I would just advocate to the group that we continue to keep all the measures that we have in place, because the situation, though manageable today, could change very quickly. And as Dr. Nelson mentioned, it is a lagging measure. And as we look 2 weeks into the future, though our staffing may be adequate today, it may not be then. And so we want to be mindful of keeping our diligence, keeping the measures in place that we need so we can keep this situation at a manageable state. And to hear, with Idaho Falls community filling up, and I know Madison will give their update, we all are in contact and keeping a close watch on what's going on in each other's hospitals, because what happens at one impacts the other. And so just know that there can be a trickle-down effect. So we want to keep things in a point where we can continue to manage it. And that's all I have for you today.
All right, thank you very much. Is there anyone else from Eastern Idaho Regional Medical Center that would like to weigh in? With that, we'll go ahead and move to Madison Memorial then. Dr. Gonzalez, thank you for joining us this morning.
Good morning, everyone. So not to, take too much time, we really are in the same status as Casey and David have reported as far as our inpatient status. Certainly outpatient, I kind of want to just add to what they've already mentioned. Outpatient wise, certainly the amount of testing coming through in the community and the resources shifting from, as a hospital system, we also have a fair amount of outpatient business, not just our inpatients. And I would also add, from Madison's perspective, the COVID positive mothers that we have. As everyone knows, we do a few babies in our facility. And so I think the point we're trying to keep today is we appreciate the measures taking to help protect all of the resources that we have in our communities, and to continue those, because we're not really sure what the weeks or months will bring. And us working really hard to coordinate and watching these transfers that are occurring of COVID patients and others, it's just new for us to see, and having to send patients to other hospitals in Utah for certain types of care. And so it'll give us pause. But everyone needs to know, when Madison received a Pocatello patient because Portneuf couldn't take care of that patient, although it's unfortunate those patients are not being cared for in their local hospitals, the coordination of all of us, the health departments, the hospitals, is what we're learning from in other hospitals, other systems, and other communities. And I just cannot emphasize us all working together and communicating the same message as probably the best lesson for today. And that's how I think that we're not just helping protect the resources of our hospitals and our outpatients and all of our workers, but I think it's sending better messages out in the community that we can get through this. And like Commissioner Mendenhall talked about, there is planning for what the next phase of this will be and what will that look like. And so we are certainly, I like to word that David used yesterday, it's tenuous right now in Madison County, but we've been working really hard and meeting daily on preparations and some of our disaster planning and all of those backup plannings, and talking to the other CEOs. So we're prepared and continuing to plan and reevaluate. So with that, I think you know, again, I just don't want to reiterate everything that the others have stated. If there's questions or specific education or things that when we meet with Jerry and her team that we can focus on from the board would be helpful for us. Thank you.
Thank you very much. Are there questions from board members for any of these hospitals?
Brian?
Go ahead, Commissioner Miller.
Mr. Chairman, I just have a question and it isn't about capacity, but it was Dr. Gonzalez mentioned COVID positive mothers. And has there any results on pregnant ladies that may have an effect on that unborn child? Do they have any history of that, what it could cause?
You know, I'll defer to the health department a little bit on this to see if they've seen anything, and I can certainly ask the pediatricians and the OBGYNs. I think we're still way early in all of this to completely know that answer. And, you know, I bring it up, one, because we're certainly known as one of the hospitals that does a lot of deliveries, and just pointing out that there's other patients that need to be cared for and require different types of resources. But there's a lot of bonding that goes on with a mother and a child, obviously in the beginning. And, you know, for a mom and everyone in that delivery room needing to wear masks or following certain protective measures is something that I think that we all need to acknowledge of the impact and the appropriate precautions that people are taking because of that new baby that's being born. And so, you know, I don't know the long-term effects. I should defer to some of the specialists on. I've not heard of any yet, but, you know, this is only, what, 6-8 months into this process. So those kids are still pretty little. We heard from Dr. Lofgren last week about the patients that we're seeing in the internal medicine clinics that are that are continuing to deal with this disease, even if they had a mild disease in the very beginning. So I'll kind of be quiet now and see if any of the others have any answers as far as the mother baby side of that.
Thank you.
Dr. Nelson, this is kind of in your expertise. Well, it is. Do you have anything to add to that? Or
The mother catches in the first trimester of the pregnancy that can cause fetal problems, but we're too new in this pandemic to see any issues. We just simply don't have any data, and there's very little data about transmission to newborns as well.
okay, thank you. Any other questions from the board? I think as a board, we've all been a little bit shocked and maybe somewhat discouraged that, you know, the measures that were taken, we are still seeing such a dramatic rise in cases. It certainly was linked with the opening of schools as was predicted. We were cautioned that would happen, and it seems like it has. But we all, again, recognize the importance of having those children in schools, and we want to see that. So I think it'd be appropriate to go to our next item and update our director and epidemiologist concerning where we're at now. Jerry?
Yes, thank you, Mr. Chairman. I'm just going to show you the numbers as of last night. You can see that as a district, we have high rates in all of our counties. I pulled for you this morning. Let me just, are you able to see that Excel spreadsheet? Hold on just a minute. I'm sorry, I just need to share, I'm sorry. Are you able to see that now?
Yes.
So this is just a 3-week snapshot, and it's just the way that I look at it every single day. Where there's yellow highlights, that indicates where an order has been in place, that a county's been in the moderate level and the board has actually issued an order. The numbers in red indicate that the county has been above the designated active rate in accordance with our plan. The black numbers indicate, and sorry, I did not update this correctly, but these should all be red in Custer County as well as Lemhi County, that they've exceeded the rates we've established to put them into the moderate risk level. So you can see all of our counties, with the exception of Clark County, have had increases in activity in their counties. We currently do not have orders in place for Clark, Lemhi, Custer, or Teton, but they are in place for Bonneville, Jefferson, Fremont, and Madison. It's hard to base everything again on active rate, and it is hard, as we talked early on in the process of, with small populations, there's a lot of variability in that, and so we do look at this every single day, but I just wanted to show you what we're seeing, that increases in all of our counties. Also wanted to share, give me just a moment. We'll go to our dashboard and show a couple of things here. So as we were talking about this earlier, and I just want to explain, sorry, I have to move the window so I can see what I'm actually looking at. So the ICU occupancy, and both Mr. Jackman and Mr. Hoffenberg spoke to this, that while this chart definitely shows that there's physical capacity with ICU beds, it does not take into account the staffing that's needed to put patients in those beds and have the healthcare personnel to take care of them. And this is something I'd like to have a more depth discussion with our hospitals about, because when anyone in the general public looks at this chart specifically, they say, well, we still have lots of ICU capacity, but it doesn't give the full picture of what is happening within our hospitals and the staffing challenges that they're faced with being able to staff these beds that are physically available. The same is true for this, the total inpatient bed occupancy. Right now we have half of our beds within our healthcare, within our region available. But again, you've heard from the hospitals that doesn't take into account the staffing that's needed to take care of patients in those beds. As we look at sorry, I'm on the wrong tab, the overview page, you can see here that the average test turnaround time is 2 days. I can tell you that it is slowly increasing. We haven't been able to update that yet with the latest data, but we're hearing from the National Reference Lab, it's now 3 to 4 days to get those results back. And I would like to pose a question to the hospitals. I know that you don't have an answer yet, but I can tell you that we've heard here from people in the community, from our own staff members, that people that are having symptoms of COVID-19 and go see their healthcare provider, the physicians are choosing not to get tests done for those patients. And I would reach out to you as hospitals to help us better understand why that is. And again, it's not a discussion for today, but that is a continuing dialogue that I would like to have, because we do have testing capacity for symptomatic patients. And I don't know if there's something that we can collectively do to provide more information to our, just the general practitioners in our region, where people are going to see their healthcare provider, because there is a lot of value in actually getting tested. So it's a conversation that I'd like to have with all of my hospital partners here in the coming days. One more thing I want to share is, and I need to go to another side, is the state of Idaho's dashboard. We do get our testing data from from the state, and it was just updated yesterday for our district. And we're seeing statewide the positivity rate increase. You can see here we had the low for the last few months came a couple weeks ago at 6.7. And again, that's the statewide test positivity rate. When you look at our health district, we have consistently been the highest of the state. And unfortunately, this data only shows through September 19th. It doesn't have the most recent data, but I can tell you, as James shared with me yesterday, going from 12.4% a week ago to up to 16% in the most current week. Even though that's not reflected here, that is what we have been informed by the state. So positivity rate is increasing. Unless there's any specific questions from our board members, we can move on from this.
Questions from the board? I guess I would have to ask on this personnel. I mean, we heard that there's not adequate nurses. Is there a shortage? Certainly there is in our area, and evidently, if we've got bed capacity, if we've got, you know, other capacities but are lacking personnel, is that just in our area, Mr. Hoffenberg?
You know, from our perspective, it's been a challenge in a couple of different ways. Going through COVID, a number of nurses and systems in places that were harder hit, New York, Texas, Florida, were putting out, one, their needs were greater, and they had put out the all points bulletin to the country to get nurses there, and had put out employment agreements, traveler agreements that were paying rates that were just so exorbitant. We lost some folks. We also have had a hard time recruiting to the region because critical care nurses, they don't grow on trees. They're hard to train, and you either have to bring new nurses in and get them to the point where they are competent, or bring in experienced nurses. And right now, at the level of care that's needing to be provided for our region, experienced nurses are hard to come by. And because we really don't have that many high-level ICUs in the region, we're not creating as many as quickly as we need them. So our goal has been to bring in experienced nurses, which we are doing. You know, EIPH has hired over 150 people over the last 3 months, and it's just but there's a lag period between them being hired, getting here, oriented, and working. And so our plan is to, going into the winter months, to be in a much better position. In fact, within the next few weeks, EIPH will be in a much better situation, but that's all dependent on the numbers we're currently seeing. So part of it's nurses being pulled to other regions, and that's just trying to catch up with competing with rates that they were getting in those harder hit areas to bring in competitive and experienced people.
Okay, thank you. That does help answer that question. Are there other questions from board members? Is there anything else, Jerry, on the update that you'd like to add?
No, Mr. Chairman.
So we'll go ahead and move to the next item on our agenda, which is an action item. It is my understanding that with our current swelling cases, with everything that we don't know right now, that we are taking a really deep look and analysis of where we go next to make sure that we are doing the right thing. What would you suggest on this, Director Rakow?
Well, Mr. Chairman, it's a hard question to answer, right? Because
yeah,
we have been taking measures as we move into the moderate risk level, the orders that we have put in place, really with the intention wanting people to do the right thing. And what we're asking people to do, regardless of what level we're in the county, is stay home when you're sick, wash your hands, stay 6 feet away from people outside of your household. And if you can't do that, wear a face covering. Not one of those measures are 100% effective. They all work together. And as we look at our counties that orders are in place, unless people follow them, they have no impact. And I am honestly discouraged with the reception from people within our health district to voluntarily take those measures. And I'm very discouraged with our ability to enforce any of those measures that we're taking. Again, certainly James and I are working with our hospital partners and other experts to try to figure out what our best course of action is. And I do want to just share one other screenshot, because I know Commissioner Mendenhall brought this up, that our numbers right. And we don't know, Commissioner, we don't know if they're right. And we're taking the evidence as it comes. And daily we're getting new scientific information. I just want to share this one metric from, sorry, obviously not sharing my screen. Give me just a moment.
Mr. Chairman, while she is pulling that up, I do need to make a clarification. I'm not questioning the numbers. Jerry, I have full confidence in you and your staff. I'm not questioning the numbers. I'm questioning at what data do we look at in making our decisions, not the numbers themselves. I believe those are absolutely accurate. Yeah.
Chairman, I didn't mean to insinuate that you were questioning the numbers, and I just misspoke in how I represented that. But the metric that we're using to base our decisions upon. So this is from Harvard Global Public Health Institute, and you can see here, a very reputable public health expert in our country. And when you look at what they're recommending, this is for the daily new cases per 100,000. If you just look at the yellow, I guess you look at the red, many of our counties are above this, having a rate of higher than 25 new cases per 100,000. And they're recommending that we have a stay home order. We know that that's not something that's going to be feasible within our region. And so we have tried to take metrics that could give us information to be able to take preventive measures ahead of time to slow things down. And we've talked all along that it's not the number of cases, it is our hospital capacity. And hearing from our hospitals today, I'm more concerned that we're going down that path, that our hospitals are struggling. And again, having all the right answers, I wish there was someone that had all the right answers, but there simply is not. And so we look at all of this information as we're trying to make our decisions and bring recommendations to the Board of Health, but it's not black and white by any means. So, Mr. Chairman, on the docket today, if we are to continue following our plan, we would take action to put Lemhi County, Custer County, and Teton County into the moderate risk level and consider orders of restrictions for those counties that would require face coverings and limitation on gatherings. I leave that up to the board to have the dialogue.
Okay. I too have been somewhat discouraged. I would not be in favor of doing anything more restrictive than we've done at this time. I mean, it would be hard for me to move to a more restrictive place and put a burden or a penalty, if you will, on some because others are not following the less restrictive. I would not be able to do that personally. And it's a little hard for me, to keep doing the same thing if we're not getting better results. And so, with the same, if we keep taking the same stance every time, but our results don't change, then I'm not sure what we're accomplishing. So I really support the idea that you have to take a much broader look at where we go from here. And I would encourage all the board members to do that as well. But as you've said, according to our plan, we would move these 3 counties back to the yellow level today, which really the only restrictions are some restriction on gatherings and wearing a face covering if you're not able to physical distance. I mean, in essence, those are the 2 things that really affect people. So I would leave it to the board. I mean, maybe that's the direction we should take, to stay with our plan until we do modify the plan. I think we do need to take a really strong look at where we go from here, because like I said, I personally would have a hard time moving any further. Thoughts from board members where we should go? I mean, according to our plan, maybe that's just the step we take today.
I think we need to consider having the mandates in place for 14 days instead of 7. We keep yo-yoing on a couple counties because their cases decrease. We lift the mandate, their cases increase again. And the 14-day cycle seems like a more logical way to do it.
Okay, and I appreciate that. And I know that certainly is something that needs to be considered. That would take a change to our plan. But it seems that we have gone back and forth with these counties. Other comments?
Mr. Chair, based on what Jerry was saying, I think I echo her frustration on all this. I would almost guess at this time, we may just want to put the brakes on everything and get into a deeper reevaluation of our plan heading into next week. Just my thoughts.
Okay. Appreciate that. Other thoughts?
Mr. Chair, Bill Lake.
Go ahead, Mr. Lake.
I'm as frustrated as anybody that the mandates that we're putting out there don't seem to be effective. And in fact, I think there's some individuals out there, I don't have any idea what the number is, but there's some out there that if you do the mandate, it's just going to cause them to dig their heels in more. So obviously having a mandate out there, we're seeing it here when I mentioned before, when I'd go to the grocery store, folks not wearing their face covering. So what I want to do here in Teton County, as soon as this meeting's over, I want to call a meeting with our community leadership and get their input about where we might want to go, and then be prepared next week to provide that input to the board and any recommendations or suggestions we have locally here in Teton County about what might work better. So I agree today that going through the effort and the time and energy it takes, Jerry, to put out a mask mandate isn't worth her time. She's got more important things to do right now to think about for the next week where we want to go. So,
all right.
I would like to say that I agree with Dr. Nelson that we need to change the plan to 14 days or some other number, because this yo-yoing thing is confusing people. But anyway, thank you.
Yeah, thank you for those comments. Commissioner Mendenhall.
Well, Bill, I need to ask you, this is absolutely non-scientific, not anything measurable, but Teton County dropped down to a significant lower amount when we had a health order in place. And when we removed that health order, now this is just an observation from you as a citizen of Teton County, was there a cavalier attitude that, oh, okay, we got down, now let's just go back to life as normal? I mean, did removing the order, did face coverings and the approach to caution go out the window?
Absolutely. In fact, as soon as that order was lifted, and keep in mind that the cities have a face covering order, we had numerous businesses and Driggs announced to everybody that, hey, you don't have to wear a mask anymore. And it was totally wrong because the cities had a mandate. So people are listening to what we're doing and ignoring even the other rules. So yeah, we can't continue the yo-yo thing. It's too confusing.
Okay. And I do agree with that. And I go back, Mr. Chairman, back to one of the public opinion comments that came in one of the emails. They went through and at first I thought they were just going to shred us. And when that email at the end, it said, all of these things aren't really taking effect. We need to get to education and telling people what they need to do. And I just thought, well, that's what we have been doing. That's what Jerry and her staff have been doing every day. But it just proved itself in Teton County that we don't want to tell people what to do, but people don't seem to grasp that they have a choice and they need to take it. Whether there's a mandate in place or not, they need to take care of things. So yeah, I appreciate your comments, Bill. And I certainly think we need to review our plan and leave things in place a lot longer. I'm not so sure once it's in there until they go to zero or so, that's too much, but we do need to review our plan of not pulling it. I've been wondering about that, Bill, up in Teton County, if people just threw it out the window. And
one follow-up to that is that our plan already in the green level says you should wear a face covering when in public.
Yeah.
I mean, that's really, and it's coming all the way down from Dr. Fauci at the national level, is you should just do it. Okay. If you can't do it and there's reasons, that's fine. But if you're out in public, it's the courteous thing to do. And why some people are choosing not to is beyond me.
And Mr. Chairman, I just want to make one other comment, because we have been asked to educate and we've been doing that from day one. I will share that I was quite disappointed when I received a personal email from a local elected official that told me to stop wasting taxpayer dollars on telling people what to do, that people know what they should do to take precautions during this pandemic. And I kindly replied, I agree that they may know what to do, but unfortunately they're not doing it. And there's nothing that we can do to make them take the precautions that we're asking. But we continue to educate every single day.
Well, I would agree. And when we say educate, we mean trying to explain the issues that the CDC, that Dr. Fauci, that we have been explained to us is the best preventive measures for this. Go ahead, Jerry.
I just wanted to reiterate what I said earlier too, and we're not only talking about the masks, it's those other factors as well. If people would stay home when they're sick, that would go to great lengths to reducing our disease incidence, but they're not doing that. They go out, and as we do investigations, people are knowingly out there sick and exposing other people. Washing hands, physical distancing, and face coverings all work together. It's not one single measure that can solve it. It has to be hand in hand with all the measures.
Yeah, and I've always felt like if you do everything else, if you keep that physical distance, you don't need the face covering. So yeah, unfortunately, it's gained the most concern by people, but it's really the last measure you need to take, but an important one if you're not able to keep that distance. And again, back to the educate. A lot of people, there's so much information out there that people feel like they they do understand, and it's contrary to what's being said. And so, you can understand the confusion by the public. I do think that it's been fairly clearly shown that these measures will help, but some people are going to stand by what they have learned, and in some ways we're going to have to respect that and understand that we're all coming along this at a different time and from a different view. So we need to, it's about time to close up the meetings. We need to decide. Board, I would accept a motion if that's your desire to move on these 3 counties, or we could defer 1 week so that we can do a really deep analysis and reflection, all of our individually, to determine what the very best path is forward, and possibly do a change of our plan that would then be able to change that order a little to be more responsive to what we need to do now. We're learning every week. And so that's why we made that plan a living document that could be altered. So Mr. Lake recommended possibly we wait 1 week. I think Commissioner Minor echoed the same.
I would like to put a motion up that we follow our plan and put the mandate in place in the 3 counties.
Okay, so that would be Lemhi, Custer, and Teton County.
Correct.
Okay, so there is a motion. Is there a second?
I'll second it, Commissioner Chairman.
So we have a motion to go ahead and move according to our current plan, Lemhi, Custer, and Teton to the moderate risk level. There's a second by Commissioner Shenton. Is there any discussion on the motion?
Mr. Chairman, may I just share that I did look at the case distribution, and for all 3 of those counties, there are cases throughout the county. It's not isolated to any one individual geographic region. So it is spread throughout the county.
Okay.
This is Bill Lake. I'd like to make a comment.
Go ahead, Bill.
Yeah, my previous comment was certainly based on, I don't think it's going to have a major impact one way or the other this week, but I'm going to vote to support putting the mandate in place and in anticipation that I hope when we revise the plan next week that our logic will be able to stay in force and keep the mandate, at least in Teton County, for a much longer time.
Okay, thank you. Is there other comments on the motion?
Mr. Chairman, I'd like a point of clarification if I could.
Go ahead.
Given what Mr. Lake is talking about, if we put that order in place today for those counties, they would be under the current plan. Would that order have to be amended if we amend the plan? In other words, if we decided to leave it in place for 14 days or longer, would those orders have to be amended, or would they automatically fall under the new improved language in the plan of leaving it in place longer? Do you see what I'm getting at? If we follow the plan right now and they fall below it, we're starting into that yo-yo effect. Would this order stay intact if we change the plan, or would we have to change the order?
Mr. Chairman, if I may.
Go ahead.
In the specific order, it does not give an end date for the order. It's just based on action by the board. So if it were put in place today and we said, okay, we're not going to take it off till 14 days, that would not have no direct impact on that particular order. So it's not outlined in that order.
Okay, thank you.
Yeah, thank you for that. Is there other questions or comments on the motion in place? Hearing none, I'll go ahead and call for a vote on the motion. All in favor, say aye.
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 Any opposed?
Aye.
Commissioner Minor? the motion does pass, then we will go ahead and put that in place according to our plan for Lemhi, Custer, and Teton. And our director will go ahead and take care of that. I would encourage everyone, as we've discussed, to do some real reflection and consideration on where we go from here. There probably needs to be some changes made one way or another, because say it doesn't make sense to keep doing the same thing if it's not working. And in some way, we don't know if it's working, right? I mean, we don't know if, even though these case counts are going up considerably, we don't know what would happen without the plan that we have. So it's a little hard to know. I know our director, our epidemiologist, along with Dr. Nelson, is going to do some real searching this next week. I would ask all the board members to plan for a lengthier meeting next week, October 8th. Plan to have a pretty broad discussion on where we go from here. And so if you can make that time in your day available, it would be very helpful. Is there anything else, Director, before we close?
No, Mr. Chairman.
Okay. I thank you for your time and for the work that you're doing.
Mr. Chairman?
We'll go ahead and bring this meeting to a close. Thank you.
Mr. Chairman, Commissioner Shenton had a comment.
Commissioner Shenton, I'm sorry.
I was just wondering, are we looking at 2 or 3 hours, and are we planning on meeting on that or Zooming that meeting too?
I would plan on 2 hours minimum. Would you agree with that, Jerry?
Yes, please.
And I would recommend that we do it the same way, although the boardroom will be available. How would you like us to be most helpful to you, Jerry, next week?
You can certainly connect by Zoom as we have been, but if you prefer to be here in person, we can accommodate that with physical distancing within our space. So sometimes it's easier when we have, documentation to look at, and it's easier to do that in person, but we will make that available on the screen as well. So I will leave that to each of your discretion if you choose to come in person.
Okay, and as always, we will stay responsive for you. So if something changes and you see you need us there or need to change the format, you just let us know by email, and we'll do the best that we can, but we will make it available both ways then.
Mr. Chairman, when we're doing something as dramatic as this plan change and revising, I would ask us to give serious consideration to meeting in person. It seems to be easier to have the discussion in person than it is on Zoom for something like this. For the meetings we've been having, very effective, but this is something that will impact the region. So I just like to have serious consideration to having us meet in person. If someone is not comfortable doing that, then so be it on Zoom, but just give that consideration.
This Chairman, this is Commissioner Young, Mr. Chairman. If we do try to meet in person, do we want to try to do that at 7 a.m. or maybe change the meeting time?
Board members, is 7 a.m. still the best time for you to carve out time in your day, or would you rather go to a different time?
If we're meeting in person, I'd prefer 8 a.m.
Is everybody going to be able to do that? I know it's been difficult with some with working in that. Anybody not able to meet at 8 a.m.? Okay, we will go ahead and plan the meeting for 8 a.m. next Thursday. We will have both formats available, but certainly if it sounds like it'd be beneficial for everyone to be at the building if possible. All right, seeing no other discussion, then we'll go ahead and call this meeting to a close. Thank you very much, everyone, for your time.
Thank you all.
Thank you.
Thank you.